Student nurses throughout the country have been left in limbo over the past few weeks after the spread of the coronavirus worldwide. Since the UK began to identify its first cases, talk on the wards was mainly laughter, some excitement. No one really understood what it was, and we still held the belief that stories heard in the media would never actually affect us. The number of cases in the UK began to rise. Staff began mask fitting in preparation. As student nurses, our placement wards never offered us mask fittings, and when we asked about this, we were simply told it was not necessary for now, except maybe in the future. Universities started to shut down, followed by shops, restaurants and cafes. Most other students began to move out of their accommodation to go back to their families. At this point, it began to feel very isolating. With only student nurses left living in the area, we started to question how long it would be until the university reached out to us. It was almost as if they'd closed everything, but forgotten we were still out on placement.
Many student nurses began to get COVID-19 cases on their wards. Others were testing patients, and some found themselves working in parts of the hospital dedicated for patients acutely ill with the virus. It began to sink in how terrifyingly real this was, and how unprepared and untrained we all felt. Student doctors, radiographers and ODPs had their placements paused in order to protect them from the outbreak. However, ours continued. We all questioned why their health was more important than their education, but not ours. We understood that these unprecedented times could be part of our career when qualified. However, being 1.5 years into training, it's a very daunting experience which none of us were trained for in the slightest. There was little PPE available in hospitals. The World Health Organization advised the use of an FFP3 respirator mask, visor, surgical gown, and 2 pairs of gloves. However, this only seemed available on infectious disease wards or those set up exclusively for COVID-19 patients.
General wards rarely had this equipment and instead were using a standard face mask, apron and gloves, which had been proven to be inadequate prevention for the virus. Training sessions on PPE began to take place within the hospitals. However, in most cases this was not offered to student nurses. Despite feeling overwhelmed by the unprecedented circumstances and lack of support as students, we still felt a certain responsibility to utilise our skills and help our overstretched NHS where possible. However, we felt exploited as untrained supernumerary students who were paying £27,750 for the course, and at this point were not being actively taught on placement due to the strain staff were facing in dealing with this crisis.
More support is needed for student nurses. Guidelines must be put in place providing the correct training, and the efforts of students working within the frontline NHS must receive recognition and adequate financial support. Written by second year student nurses, BSc Adult Nursing.